Hi, everybody. I'm Dr. Wright, and I'm going to be talking about mobility improvements with lipedema reduction surgery. And this is something I prepared for the Fat Disorders Research Society talk, but I'm giving a special webinar presentation of it, and this is also information that I'm getting ready to publish in a paper to for my peers to review. So without further ado, here I go. I This isn't really relevant to this, but I have Tactile has supported research for me, but not this specific research I'm sharing. And they've also supported me to speak to educate other physicians and providers about lipedema. So I'm talking about lipedema reduction surgery, and that is different from cosmetic liposuction. There are many differences. It's a large volume. It uses techniques to reduce the risk of lymphatic injury. Um, there, I've reported on, and others have reported on, that lymphatic injury can occur from liposuction in ladies with lipedema. Um, and so it's a different. It's not your cosmetic liposuction, but this is a large volume to bulk the tissues, and so it's not just removing with liposuction cannulas, but also the techniques that I use are involved manual extraction of fibrous tissue that did not get removed from the liposuction, and that's gonna so when I share the results of of the benefits that we were able to observe, that I'm describing them in conjunction with this lipedema reduction surgery, and it does improve knee mechanics, including alignment, flexion, and gait. And I'm going to get into that without further ado. This is again, so these are large volume, and just a little more about the surgery is that the average aspirate was over 6 liters, and um, and and the range is quite significant. So it's, for example, the inner and anterior thighs here. The largest surgery we got 13.8 liters. So now, again, there's a large range, and that all depends on the size of the lady and the amount of lipedema tissue. So not everybody would it be safe to remove 13.8 liters, and obviously those are on the larger ladies with lots of lipedema tissue. But this is sort of the aspirate results, and you can see some areas get some areas we're able to have more lipedema tissue, and we're able to remove more. And these are long procedures. These are much longer than, like, say, a cosmetic liposuction. The average time was 5.2 hours, and that involves part of that's part of the prep to identify lymphatic structures and key venous structures, so that we're not going to injure them, and then multiple positionings, et cetera. So there is a lot involved in the time. It goes into these surgeries much more than, say, a cosmetic liposuction. So this is a lady with lipedema, and you can see here, this is with long arm goniometer, and so this is how we measure the knee flexion. I'm going to show you the data on that, but basically, you can see here that this is aligned with her femur, and this with her fibula, and so she has a restricted knee flexion. She's actually slightly under 90 degrees, which is well below normal. Normal would be 135, and that would be evidenced by that green line. And that's just the bulk of the lipedema tissue causing the restriction in the knee flexion, and that affects knee function and mobility, and we'll get into that. So normal knee flexion required for these activities. I mean, getting out, you need 135 to get out of a bathtub or getting in and out of a car without difficulty. And so these lipedema ladies, the one that I just showed you there, she's around 90 degrees, and that's gonna limit her ability to do many of the activities. She's able to barely climb stairs and and cycle, but and walk on flat ground, but she's limited in many other activities are just troubled by the restrictions imposed by her lipedema. So following the lipedema reduction surgery, knee flexion improved by 8 or 9 degrees, and that's significant. I mean, that can make a difference. Again, can if you're restricted, and it can give you allow safer up and down stairs or all sorts of things. And consequently, we also saw that the improvement in gait after the surgery. They were able from 21% had a normal gait prior to surgery, and that improved to 80% after the reduction surgeries. And the knee alignment improved by 3 degrees. Just so the mechanics all around the knee all improved with as a result of these surgeries. We looked at this is Promise and Rand, and these are used in clinical research, and they're highly validated, and they're also used in practice, and they were developed by the Rand Corporation and the NIH, and they're normalized the population, so they're able to be compared among many different diseases, and so we're able that gives us important to compare how much benefit we can give our lipedema ladies with this surgery compared to other procedures other patients get. So we saw here that all these are composites of their global health. The physical functioning improved significantly. Role of physical function, role of emotional function, energy and fatigue improved significantly. Was below the mean and improved above the mean. Social functioning, overall pain, general health improved. And this is just the same data graphed in a so we can see steady improvements through before and after the surgery. Their composite mobility, and this is highly significant, that they the overall there's a mobility function, and so they average lipedema lady was significantly below the mean and improved just under the population mean in mobility. Now here are some really interesting things. So there was a 15% ability to walk at a normal speed, and there was multiple questions. So we showed that their gait improved in those physical directly observed physical changes, but that improved this normal walking speed, and correlates with overall measured gait velocity, and this is actually an indicator for whether or not someone might become disabled, and even impact on their mortality. So this improvement in these lipedema ladies is highly significant, and really is so this is the first data I'm aware of that can relate how the improvements can lower the risk of future disability and lower the risk of even death. So there's an 18% improvement in the ability to go up and down stairs. Again, stair ascent and descent is also correlated with these same things I showed. There's a 15% ability to get up from without help, and there's also an ability to uh, get up from a chair, and all those are really important indicators, and really show that uh, these are these impacts we're having on the function of ladies with lipedema after the improvements they see after the surgery are can have can greatly improve their overall quality of life. So so how does this compare? What our lipedema? How does it compare to a total knee arthroscopy or a knee replacement? So we actually are seeing similar improvements in gait, uh, uh, perhaps actually slightly better improvements in knee function, and about the same improvements in knee alignment. And so that's really powerful, because I mean, obviously, people understand intuitively if you have a if you have a knee that's got such bad arthritis, it's that, we don't think twice about replacing that. But we're seeing the same kind of improvements in these physical functions and knee mechanics as they see with a total knee replacement. And the improved walking speed, stair ascent, sit to stand are also similar in terms of that, of what our lipedema reduction surgery and a total knee replacement, and and the improvements in the global health measures and quality of life. Now, people need to understand that the total knee arthroscopy or knee replacement is the most common orthopedic surgery done, and it can cost $60,000 to $100,000. So I mean, I feel like lipedema reduction surgery is a great deal, in that we can get those same kind of things, and lipedema reduction surgery should not cost 60 to 100,000. I just want to put a little plug about Lipedema World Alliance. That's a new organization that we're looking for participations of patients and other professionals to share about the best scientific evidence to treat and improve the lives of ladies with lipedema. Thank you very much for your attention. I really appreciate it, and I hope this was of help to you, and I hope to do more. And you know, so if you like this, you feel free to answer, put questions in there, and I'll try and get to them in the comment section. Um, Wishing you all the best of health, uh, and again, thank you for your attention.